FM, The Source.
All right, thank you. 22 minutes after 11 o'clock. Did you see that video? I don't know if it was new or if I was seeing something that was old, but it was a guy jumped out of an airplane without a parachute, landed in this big old net.
No.
Oh my
gosh, how scary.
And the narrator said he has to land on his back, I think it was. Yeah, had to land on his back.
Mm-hmm.
And it went, and his wife was in the spectator stands, and of course she comes running out, and she's probably thanking God that he didn't get killed. I can't imagine jumping out of an airplane. But when you do, you probably have some pain throughout your life. Boy, how about that for a segue, huh?
Yeah.
Dr. Corey Hunter is an interventional pain specialist at the Ainsworth Institute of Pain Management and the assistant clinical professor at Mount Sinai. Doug Rod is with him. He's a medically retired United States Army paratrooper, which is why I was describing that guy who jumped out of the plane. He was with the 82nd Airborne. He lives with complex regional pain syndrome. I don't know what that is, but we're going to find out. September is Pain Awareness Month, it says here. Dr. Hunter and Doug Rod, good morning to both of you.
Good morning. Hello.
And thank you for your service, Doug.
It's an honor. Thank you.
So what, I guess we'll start with the definition. What is complex regional pain syndrome?
So complex regional pain syndrome, we usually abbreviate as CRPS. It's something that not a lot of people know about unless they're unfortunate enough to have it or know someone that has it. It's so frustrating to us because it's a mystery as to why some people get it and some people don't, because it can start off as something, as simple as, just a basic injury or going for routine surgery and the body heals, but the pain just kind of persists and doesn't go away. And it gets progressively worse to the point where you can't even use your limb anymore.
You can't use your what?
Limb.
You can't even use your limb anymore. So if it was your leg or your arm,
okay.
The pain gets so bad you can't even, hold a cup of coffee, or you can't even walk or put on a sock.
Okay, is this Doug talking? Is this Doug?
This is Dr. Hunter.
Oh, Dr. Hunter. Okay. So, Doug, do you have a limb that's hard to use or unusable?
Well, actually, I've had all combined about 20 different surgeries on my legs.
Oh my gosh.
So the last surgery I had was a success. It was a knee replacement at the hospital special surgery. They did a stellar job. But unfortunately, I was left with this condition of complex regional pain syndrome where I had a nerve that just would not calm down. And so consequently, to get through the day, I relied totally on opiates and spinal cord stimulator. It became a way of life.
And is this a result of your work as a paratrooper?
Well, that was the start of it.
Doctor, when we hear about somebody having phantom pain when they have had a limb amputated, is it similar to what we're talking about?
That's a great question, actually. Thank you for asking that. So I've done a lot of research recently on amputee pain. That's one of the hardest things we have to treat, is because it's so confusing. And the person, had a limb amputated, and the body really doesn't know how to handle not having that limb there. So it's very similar. It's a different kind of process, a different kind of pain, but it's equally as challenging. And there really traditionally hasn't been anything to kind of treat, complex regional pain syndrome, or as you just mentioned, phantom limb pain.
And what is the other note? Other thing from my notes is dorsal root ganglion therapy. What is that?
Sure. We actually abbreviated DRG stimulation. So what it is, Abbott, it's made by a company, Abbott, which most people are familiar with. Abbott's DRG stimulator is the first of its kind because it's the first time we've had like a reliable, proven therapy for chronic pain. And we also, we use it for complex regional pain syndrome. Phantom limb pain is one of the things that I've done some research on, found it's very effective for that. And what it does is very similar to a cardiac pacemaker, which everyone's familiar with, where, you deliver small little electrical signals to the heart to get it to beat correctly, except in this case, we're using it for the nervous system. We deliver small little electrical impulses that the patient can't feel to basically treat pain. So in Doug's case, it was, treat his knee.
And so you no longer need to take opioids, Doug?
Actually, I had the Abbott's DRG stimulator implanted the day after Thanksgiving last year.
Okay.
And I am just thrilled to tell you that after 10 years of
opioid therapy and
wow.
spinal stimulation that I have not had pain medication since the second week of February.
Oh my gosh! So the pain is gone, and the after effects or side effects of the opioid medication is probably gone also, right?
Yeah, that didn't go quietly into the night, but I'm just glad to have it behind me, and I'm living a normal life again.
Oh my gosh! How long did it take to get through the withdrawal?
Yeah, I took a week off from work to get through the last couple of doses, but it was a process, and my doctor took me through a process right up to the last 2 doses.
And the doctor, are you able to take this therapy one step further for research for people that have had spinal injuries that no longer can use their lower extremities at all and try to bring that back?
So it's meant for pain. If the person find that they can't move their leg, for example, because of the pain, that's where it works. So in places like things like complex regional pain syndrome, the pain becomes so debilitating the person may not even be able to. There may be like a contracture, like their foot's all kind of like twisted. And in that case, yeah, we can use it for that. We can relieve the pain. The blood flow will start to return to normal, and the patient can use it again. And sometimes it's within minutes that you'll see this change. And then there's just the rehabilitation process to kind of get the strength back in their leg.
Wow. And is there a battery that needs to be replaced now and then, or?
There is, yeah. So just like a cardiac pacemaker, the battery, in this case, it lasts about 5 to 7 years. And what we like to say in, the doctors that do it, is to set it and forget it. You put it in, there's a couple little adjustments here and there, but I'm sure as Doug can tell you, there's really no maintenance at all. There's the ability to kind of program it. So it's embedded with Apple technology. So you can actually integrate it with an iPod Touch and kind of program it. And it works, works wirelessly. And then you can just make little changes here and there, maybe for whatever reason you wanted to turn it off. And then after 5 to 7 years, it's a simple procedure just to replace the battery.
Wow. The important thing is that it works. If we had more time, I would ask you to try to explain the science behind it. Not that I would understand it, but I would probably go there. But we're out of time. Give me a website so we can enable our listeners to find out more.
Sure. If you're interested in learning more about Abbott's DRG stimulator, go to aboutyourpain.com. And it'll really describe for you, this really life-changing therapy. You can learn more about, the conditions we're using to treat with it. And most importantly, there's a physician finder on it where you can plug in your zip code and it'll give you a list of physicians and pain management experts in your area that are trained in it. And then make an appointment and discuss it with the doctor and see if this is right for you.
Very good. Doug, again, thank you for your service. And I'm glad you're feeling better. I'm glad you don't need the opioids. And Dr. Corey Hunter, thank you for your service as well. You're both making this world a better place. Thank you for what you're doing.
Thank you so much.
Thank you.
All right, we'll be right back.
I operate at the highest standards, and when they are not met, I take action.
Fox's Catherine Herridge, authorities looking for the murder weapon in the killing of Iowa College student Molly Tibbetts, who a man in the country illegally has confessed to killing.
With the release of Molly Tibbetts' autopsy results, a medical examiner says her death was, quote, homicide resulting from multiple sharp force injuries.